Lockdown feels like an eternity for a lot of people, but for some people, lockdown never even happened. For key workers across the country have been putting their health and indeed their lives at risk doing essential work to keep this country running. Now, we asked 4 of these workers: a postal worker,
Morning.
a cycle courier delivering medical supplies, a care home worker,
Probably start now.
and a security guard.
Started our shift at 7 p.m. and will be finished at 7 o'clock in the morning.
We asked them how they've been coping and, above all else, if enough was being done to keep them safe.
Tuesday, the 19th of May 2020, arriving to work.
Hey Selena,
Hiya.
how are we doing?
I'm good, thank you. How are you?
Alright, so what are you doing now? You're out and about.
I've literally just finished work, so yeah.
How's work now compared to at the start of lockdown? What's changed?
The volume of parcels have gone sky high. Probably worse than Christmas.
Wow.
Yeah, because everybody's at home ordering. So I suppose on top of being bored, they just want something to do as well.
Did you ever have days where you were worried about going into work?
Yeah, just because it's all about health and safety, and we share vans and we share bays and stuff like that, so it's making sure that everywhere's clean and you've got the correct PPE.
Did you have the right PPE from the start?
No.
What did you have?
To begin with, we had nothing, and then it got to a stage where the manager went out and got some hand sanitizer because everybody kind of refused to work without the correct equipment.
So this is our protective equipment. Bathroom cleaner. Okay, so I've bought my own wipes because I refuse to use bathroom cleaner to clean the van. I have to think about mine and my family's health and safety.
Did you feel angry or worried or whatever when you just didn't have the right PPE?
More angry than worried, because I personally went and bought my own, but it's for Royal Mail to provide the correct equipment, which they was quite blasé about.
In terms of social distancing, that's the big thing, social distance, 2 meters. Is that possible?
It's doable, but because we're such a big office, it's a struggle.
Coronavirus hasn't hit everyone equally. Amongst people from, black and minority ethnic backgrounds, the death rate's been twice as high. For black people overall, up to 4 times as high. How do you feel about that?
It's quite worrying, but all I can do is just take each day as it comes and just be quite observant and concentrate on what I'm doing.
I work with young adults with support needs as a support worker, 2 of which are particularly vulnerable to the virus.
It's been estimated that up to 22,000 people have died in care homes during this pandemic, which is obviously terrible. Has that weighed on your mind, the risk to the people you work with?
Particularly at the start, it was really scary because 2 of our staff members had symptoms, but this was before the tests were available.
We've got masks that we change every 4 hours. Visor as well. Just going to tie my hair up.
Now, a lot of people have been working from home or been furloughed. That's not true with you, is it?
No, I've been doing 40-hour shifts at a care home.
I mean, do you think generally there's been, where do you stand on the government's approach with the whole care sector more generally?
I think the tests just came in a lot later than they needed to be, and everything was just implemented way too late because we were really fearful of if it did come in. And finally, I think we're at a place where we're secure in that it probably won't get in now because we're all taking really good precautions and we're not using any agency staff, so it's all the same people coming in.
Now, one of the big discussions during this whole pandemic is centred on personal protective equipment for people on the front line. What's the situation been for you?
We've been really lucky, actually, I think. We got it quite early on, and we've got masks, aprons, visors.
Just having a very quick toilet break and just going to change my mask over as well. sanitise my hands again, and make sure this one goes in the yellow bin.
What does it mean in practice? How much more difficult does it make your job?
It is quite difficult. Obviously, like interacting with people as well who rely a lot on your facial expressions a lot of the time.
The residents, do they respond okay to the fact you're wandering around with all of that on you?
Surprisingly well. There's been a bit of poking at our faces. I had some odd looks at the start, like, what are you doing? One of our support workers got called Buzz Lightyear. It's funny.
So, social distancing, 2 metres, etc. Is that practical in your workplace?
No, not at all. A lot of the support that people need, we have to be really close to them, like obviously personal care. We wear like gloves and aprons and stuff that we change, but one of our residents, like, we have to hold her hand to support her while she walks and stuff, because she's very unsteady on her feet, and like help them with eating and stuff, because she's a choking hazard.
So this is just by a park. These placards celebrating all the key workers, all the people who have, put their lives on the line to keep things moving.
Explain to people, what is it you do?
I work for a private medical company where we pick up specimens from NHS hospitals, bring them back to the lab for testing, and then the results go out to the patients. Recently, obviously with the pandemic kind of taking over, we were seeing more and more yellow labels on specimens, which signified they were coronavirus.
Did you get enough PPE, you and your colleagues?
We were forced to send a letter before action, and then shortly after we were issued with hand sanitizer, and we've been given these single-use masks, which aren't fit for purpose. But beyond that, no, we've had to wrestle basic PPE out of them.
And we're told, obviously, social distancing, we have to continue that as much as we can. How easy is that in your work?
In my profession, social distancing is really hard to abide by, from picking up specimens to going in places where you're in close proximity to people to where we drop off and stuff. It's really hard to be able to maintain that. There are certain times where you kind of just give up on it. There's this whole talk of people returning to work and making various markings on the floor so people respect this. It's a complete front because it's just simply impossible.
And what's the impact been working through this pandemic on your family?
My life has stayed fairly normal. I've still been going out to work 5 days a week. I've still been out and about and getting, loads of fresh air, which, a lot of people haven't. The stuff you're seeing on the streets, people who have fallen through the cracks, has been really disturbing.
We're in the middle of a pandemic, you're a key worker, and you've been told you're being made redundant. What's happened?
So, I've worked throughout the pandemic. Just as we're starting to get towards things starting to resemble some form of normality, I was told I was going to be made redundant.
Business is picking back up. Places are starting to reopen, just like people are starting to return to the streets. It's comforting to see a return to normality, but with the lingering thought of redundancy hanging over my head, it's bittersweet.
Hello, I'm setting off to start my night shift.
Tell me about you. You've carried on working. So where have you been working?
I work at St George's University of London in Tooting. I'm one of the security supervisors there.
I mean, in terms of your own job, has it got easier or harder since lockdown began?
I would say definitely harder. We're still going in, carrying out our normal daily duties. We're trying to follow the guidelines in place, social distancing, but because we work in a control room, as much as we are trying to follow these 2 metre social distancing in place, it's impossible because we're working together a 12-hour shift. Because we're embedded in the hospital, the university, we're in contact with the nurses. They're coming in and out of our buildings. And obviously, when I come home, my family, we are still interacting with everyone. And I believe that we are cross-contaminating.
Is there anything you and your fellow workers have done to try and put pressure on the company to get you the PPE that you need?
Some of the workers there, Owen, we actually walked out because we was not happy with the working conditions. Mm-hmm. And we walked out for about 2 shifts. They didn't even do a risk assessment Wow. Until we raised these concerns. Mm-hmm. And then they miraculously done a risk assessment.
And was this during lockdown?
This was during the lockdown, yes. Wow. And the only reason we returned back to work, Owen, is because we don't get sick pay. And we don't get the benefits. And we had no choice but to go back to work because financially we could not sustain that.
I'm a bit anxious and worried to see how busy the bus is going to be and to travel to work after the government announcing that people can start going back to work. So hopefully the bus is not going to be too packed and that there's going to be 2 meters distances.
What sort of other people are on the bus? Who do you think is getting the bus at the moment, and how busy are the buses?
From what I can see, it's all the BAME workers, all the ethnic minorities, like myself, I'm sure they're key workers having to go into work because they're not entitled to any of the benefits to stay at home and get paid.
According to the Office of National Statistics, they've looked at the most dangerous occupations in the country, and one of the most dangerous is being a male security guard. How does that make you feel?
On top of all of this which is going on, this is just another added, stress which is put upon us. I'm grateful just to be able to carry on and to try to live a normal life.
And there's been a bit of debate about the government slogan, which changed from stay at home to stay alert. What does stay alert mean to you?
Can anybody explain what stay alert means? I don't think even the government knows stay alert. I think it's atrocious. We've lost over 35,000 lives with this COVID-19 virus. I think the government needs to step up, take responsibility and look after their people.
Good morning. Finished my night shift, 12-hour shift.
It's about 9:30 now. I just had a quick bath and now I'm playing with my hamster.
We clap, don't we? Millions of us. Every Thursday to show our appreciation for essential workers like those we chatted to in this video. But is it enough? That symbolic appreciation when so much practically could have been done to help and protect these essential workers. Now, I don't know if you noticed, but 3 of those key workers we interviewed in this video had to fight to get protective personal equipment from their own employers. Now, this crisis certainly raises a lot of questions. Will it mean lasting support for those workers who, unlike us at home, have sacrificed so much to work every day, leaving their families to go to the front lines of a deadly pandemic? Or will nothing change at all? I suppose that's something we're certainly going to find out in the coming months.